We're live.
All right, good morning. This is Senate Health and Welfare. We're looking at H 542, which has come back. It's here in the Senate. We're looking at an amendment, the bill, and an amendment from the Committee on Finance. And the consideration for us, we just frankly, we don't have time to go through the whole PCV testing issue that's embedded in the bill and the effects of PCV on kids or staff in schools, but what we have looked at it years previously, and I think we're all aware of it.
I know PCPs, yeah.
You know, so, but, Michael, maybe help us understand just briefly what's in the bill and what the finance amendment does.
Sure. This is Mike Grading with French Council, just to give you context for what the H 542 does. In 2021, in the appropriations bill, the General Assembly required that all schools that were constructed or renovated prior to 1980 do indoor air quality testing for PCBs. And they were supposed to complete that testing by 2024. And at the same time, the state committed to pay for all of the investigation, remediation, and removal of PCBs that were discovered through testing. Subsequently, you extended that deadline to 2027. You did continue to commit to paying for all of the investigation, remediation, and removal. In 1 year, you appropriated approximately $32 million for that, for grants for that, including $16 million for Burlington. You subsequently appropriated another 9.5, and then also made some money available from the Environmental Contingency Fund, which is a fund that ANR has to respond to hazardous waste issues or hazardous materials issues. So the testing has been ongoing. There are 328 schools in Vermont that were built or renovated before 1980. 183 have had an inventory. An inventory is before you do the actual sampling, you do an assessment of what needs to be sampled. 150 schools have been sampled. 46 schools have had PCBs detected above the state action level. 145 schools still need the inventory, so pre-testing and assessment. And 171 schools need the indoor air sampling. Problem is there's no more money. So in doing the sampling and finding schools with issues, especially schools with significant issues, there's been significant funding that has been spent to bring those schools to a standard that's safe for students and other users of the school. The House Bill H 542 proposed to end the testing program entirely. So there would still be those 171 schools that would still need sampling or testing and would not need to continue with that. They would have paid for those schools that were already in the pipeline that were testing or had tested and discovered issues. But money would have been needed to have been appropriated for that, or the school would basically pause their response until money was appropriated. Your Senate Education Committee disagreed with that approach. Instead of ending the testing program, they extended the testing program. They pushed out the testing program to August 1, 2031. They also created a special fund that could be used to provide grants to schools to do testing, but there's no money in it.
I was going to ask. That's the favorite kind of fun.
It does have a potential revenue source in that the state is currently suing PCB manufacturers. And it's not just, pie in the sky speculative litigation. There has been litigation in other states, and there have been pretty sizable settlements. So there is, a reasonable assumption that there will be money available, but litigation takes time. The litigation's still only in discovery mode. It will take probably years before there's a order or settlement. So the Senate Education Committee in the looking at that pushed the deadline out to 2031. Senate and Finance looked at that issue and pushed it out to 2035 after taking some testimony from the Attorney General. The other thing that the Senate Education Committee bill does is it changes the school construction funding process, which you just enacted, and just will go into effect this July. Part of what you are doing is the school construction aid grant program, which also has no money. But if a school were to engage that process, there's procedure for what they need to do. And there's what basically you need to do an assessment of your school. As part of that assessment of your school, if you haven't tested already, you will be required to test. You can get money for that from the special fund,
which doesn't
which
exist.
doesn't have any money.
Well, it exists, but it's no money in it.
So
Does the Finance Committee amendment affect the capital, the construction fund? And
it
everything?
does not.
Okay, so that would, regardless, okay.
Right. So
And it's not our jurisdiction to do that. Adding PCB makes a lot of sense if there's money, but
the Finance Committee does amend the special fund, but only because the Attorney General wanted some wording tweaks and because JFO wanted the wording tweaks as well.
okay. Oh, and JFO also,
Yeah.
okay.
House, your Appropriations Committee looked at the bill yesterday. They did not vote on it. They want to explore.
We're looking at it today.
Yes, they are, and they're trying to find some funding. They're going to see if there's money available in the Environmental Contingency Fund. They're going to see if there's money available in the budgeting contingency funds.
House. This do that.
No, Senate approach.
Senate approves. Okay.
I did say that. I started with.
I was. It's
Yeah,
okay.
that's fine.
Um,
But they voted. They didn't vote. They basically said, let's see what the possibility is for some funds before we vote. And so there may be an effort to find money to put in such a fund this year.
There you have it. So, I mean, the question is, the question for us is it important to extend the deadline to ensure testing in schools or not? And then the second question is, well, if we support the Education Committee, it's 2031. If we support the Finance Committee with testimony from the AG and JFO, it's 2035. And I think Senator Gulick wants to comment on this from your experience.
if you don't mind, I mean,
great. I like it.
I could write a short tome on this topic, but I will just speak to the Finance Committee, because I think what we were grappling with was acknowledging that these are harmful chemicals that need to be addressed, and you can't just ignore that they're out there. But at the same time, we called it before the mother of all unfunded mandates. So so we have this tension, right? So we thought pushing the date out to 2035, when after, possibly litigation will be completed at that point, and, also acknowledging that there's a lot of school construction aid and merging of school districts and potential, who knows, closing some schools, that all of that is at play with this. And so giving ourselves more time just makes sense. And I've been advocating for this PCB program from day one to be part of the school construction, system or potential system. We don't have a system quite yet, but so I personally you know, barring the complete shutdown of the program, which I don't think is necessarily a good idea. I do think that moving it out to 2035 is a good option. It's actually pushing.
Yeah. I guess I don't mind that, but as an example. Right now you have some that have some funding, some that aren't gonna have any funding. And you were still going to mandate that they perform these tests according to Ledge Council. And
The deadline the language says all schools shall be tested, and then it's just a question of what date.
okay. So then my other issue is then we're gonna force them to do that, and then they're gonna be outlaying their own funds.
You know, so A&R is required by the language to do the testing. And then there's language that says the state has to pay for it.
Okay.
So the
That's
state might pay for it through a reimbursement process, so maybe the school district has to outlay first, but then the state will reimburse for it.
Yeah, I thought there wasn't any money.
There isn't it.
Well,
So nothing's gonna happen.
that's so right. So nothing is going to
I- you
happen.
know,
And if I was a
I
school
mean-
district guy, I'd say,
I
I'm gonna
had
wait till
some,
the
I
money's
had some really great conversations with ANR, and they support this. They support the push out of the date. They support keeping it going because
Well, it's a
they
good goal.
want us to have schools that aren't getting the PCBs. So,
well, North
and
Korea.
they're willing, North Country is like an incredible story. I agree with you. ANR wants to work with schools and wants to work with the agency and wants to be a partner in this, and they don't want to be this like hammer of regulatory, force. That's through the conversations I've had with them. That's what they're hoping for.
Gonna throw out a wild idea.
Uh-oh.
That may not have any validity, but when we apply next year for moral health,
RHT,
this is a health issue.
it is, but here's one of the problems. I know where you're going with this one. The RHT
Yeah.
will fund programs that are currently going on, so would it have to be new?
So
And also
It would be problematic. We could talk.
let it expire.
That's,
Well, I don't know. We can ask. We can,
I'm
we
just
can,
looking
it's a
for
good
a way.
creative suggestion. It's a good creative suggestion.
So darn transformers,
Not just transformers, it's in tiles, it's in countertops, it's in insulation, it's everywhere.
It's all over the place.
I just had.
Yeah, I know, transformers.
Some of it's already leached out, bled out.
Yeah. Because I've done these before.
Yeah.
With buildings where you have to go and have them tested and then torn down and they have.
So,
Somebody comes to.
oh, and then the cleanup.
Yeah.
Why
It's a whole other,
no,
pushing it
the
out?
radon is also an issue.
you're good with that?
Yeah.
Yeah. Could be,
John.
I mean, I think,
I-
we'll be talking in appropriations later today and, yeah, go ahead. We have your straw poll. This is great. So
Oh, yes.
appropriations will continue
I haven't.
with it.
Yes. 35.
Okay, got it. F-35s.
Yeah, in Burlington.
Wait, who voted for? Okay, sure. So I don't know what you're thinking.
No,
Yeah.
I'm for it. It's just. I just don't want to see the school districts get burned.
No, you're right. No,
Neither
that's
do
why.
I.
But,
Because lots of times those dollars come like FEMA, state dollars, these projects that I get into, you have to front the money.
right.
And then you're caught. So basically you're probably gonna borrow the dollars. And then you'll be paying interest on it.
Yeah.
And then you're gonna go back to your voters, because it doesn't happen in that year for an increase. And then we're gonna be blaming the state as an unfunded mandate.
Everybody will be pointing fingers.
Yeah, and so it's just gonna be the same old, same old.
Well, it is frustrating, isn't it? So,
Yeah.
but
Uh,
I'm fine with the 35.
Yeah.
I'm fine with supporting what finance has done, and we'll see what appropriations does this afternoon. It might help.
I mean, one thing we
Drop
learned
in the
in
bucket.
COVID is that, having kids, alone at home and not with their peer groups, and it's detrimental to their health also. So that's the other thing we have to win, like,
We want them to have a.
You know,
social
we want
socialization.
to.
Well, you gotta find funny spots.
I agree. This is, like I said.
So,
Okay, so
Unfunded mandate.
we get it. We understand. So are we good with the F-35
Thank you.
with the?
yeah, you're on airplanes.
Yes, we are good with it.
All right, great.
Thank you very much.
Yeah, have a great day.
Appreciate it.
You too.
I have one quick thing. We have the confirmation for the Secretary of Human Services. And I have her resume,
She's underlined, it must be in the calendar.
yeah. So she's a public health leader for more than 30 years in complex health and human services systems, healthcare reform and Medicaid, public health strategy, crisis emergency response, mental health, substance use system, so a broad range of work. She has been overseeing AHS, COVID-19 response, help shape Vermont healthcare reform initiative. She has worked very closely with us on that.
She's not on here though.
Huh?
She's not in here.
We haven't sent her up.
Okay.
We're sending her up.
Yeah.
Maybe, I don't know.
Yeah,
She's been secretary since 2022 and, which is a $5.2 billion budget with 4,000 employees. She, was deputy secretary for 2 years, deputy commissioner and principal assistant for Viva for 2 years. Blueprint for Health, she was very instrumental in getting that, stood up. After it got started, then she came in with, lead poisoning prevention program coordinator. Leadership positions, for HIV prevention, health workforce development. She has a master's of science and community health education, from Illinois, and a bachelor of science in nutrition from University of Vermont. I would put her name forward, for confirmation. You're good with that? It's probably okay with George.
absolutely.
All right, good.
And are we doing these tomorrow on the floor? Is that?
If we get, I think probably, yeah, maybe our last Friday.
Maybe.
No.
Maybe.
Maybe.
I would be fine with that.
Yes.
All right,
Okay, wonderful.
thank you. So Emery, thank you.
Yeah.
Okay, and we can go off live and we'll follow it from this baby.
Every